Environment check. Okay. Here is my Seneca card. Oh my gosh, where is it? Okay. My name is Hager Taha, Hagertaha. I will be presenting the Neuro, Pain, and Respiratory Assessment. I will begin with the vital signs. The patient's temperature is 39.7, the patient's heart rate is 115, his blood pressure is 115/70, and his respiration rate is 22. So these are abnormal values. The 39.7 indicates he's febrile, which could indicate an infection. He's also tachycardic, which could be because of the pain or an underlying infection or stress from being at a hospital. And he's also tachypnic, could be because of his mild cough that he's experiencing with some chest tightness, so his body could be overcompensating. Now I will begin with asking the patient 8 questions. Do you have a headache?
Yes, and my neck is really stiff.
All right, are you experiencing any dizziness or is the room spinning around you?
Yes, I feel dizzy and it's making me nauseous.
Okay, have you hit your head recently or had any head injuries?
No.
Okay, do you have any tingling sensation in your hands or feet?
No.
Okay, are you experiencing any difficulty swallowing?
No.
Do you have any shortness of breath?
No.
Do you have a cough?
Yes, I have a cough, but it's not too bad.
And are you coughing anything up?
No.
Okay, do you have any pain when you breathe?
No, but my chest hurts a little.
Okay, let's go back to the pain. So when did the pain start?
It started 1 day ago, worse today.
Okay, and how would you, is the pain getting worse when you do anything?
Usually with movement and lights.
Okay, and how would you describe your pain?
Like a throbbing.
And does it move anywhere?
It's all over my head.
Okay, and if you were to rate it on 1 to 10, 10 being the worst?
8 to 10 the worst.
And is it constant, ongoing? Does it
All
come
the
and go? Okay, and how do you understand this pain? What do you think this pain is causing you?
I don't know, I just feel so sick.
Okay, and have you taken anything for it?
I tried to take Tylenol and Advil, but it did not work.
Okay, so now looking at the patient's assessment, the patient's behavior is a little guarded. It could be because of the pain. However, his skin is otherwise intact. He is in an upright position. He is in no respiratory distress. There are no obvious signs of any extra work of breathing. He's not using his abdomen or his neck. The patient's GCS is 15, so he is alert and oriented, and he is oriented to time and place. His eyes are open spontaneously. They are responding verbally to me. He's able to follow commands and speak when I ask him. In terms of his eyes, his pupils are equal, they're reactive to light, and they are round. Now, I will begin with doing my assessment. Just squeeze my fingers, good, and with this, very good, and push, 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 very good. So the patient's grip strength is very strong, and his legs are also strong. They're able to respond to commands, and they are also able to withstand any resistance. To begin my anterior auscultation, I will begin by finding the clavicle and putting it up here on the left side. Breathe in. Here I'm listening for some bronchial noises, which are quite high-pitched and loud. And then I'm going to move into the second intercostal space while the patient breathes, then the third intercostal space, now the fourth, and the fifth. Should be in the mid-axillary line around, potentially around here and here. And moving to the back, I will again begin on the left side, moving up, ensuring that I am not near the scapula. And moving on the left, as the patient breathes, moving down to the second intercostal space. And now the third, just making sure I'm still remaining within the spine. Fourth, fifth, sixth, seventh, and 8. Perfect. So the patient's lung sounds are clear. His chest is clear with no advantageous sounds. Some sounds I could be hearing is either diminished or fine crackles. Could be because of the pneumonia or potentially any consolidation. Now, moving on from this, some things that I would expect from this patient is that, well, they presented here to the hospital as a 17-year-old male. They are here for headache, nausea, some chest tightness, and a mild cough. As per the background, the patient indicates that the pain is an 8 out of 10. He does have a history of diabetes. His father is also experiencing some hypertension, and he's been in and out of the hospital because of uncontrolled diabetes. Now, the patient did state that he does have some dizziness as well, some chest tightness, a mild cough, and along with that, the patient states that the Tylenol has not been effective to him. Now, in terms of my findings, the patient is febrile with 39.7. He's tachypnic and tachycardic. However, the chest sounds are clear. The patient is GCS of 15, and his chest expansion is clear. His oxygen, he is showing no signs of cyanosis in his lips, and he is also strong. Now, in terms of what I would suggest, I would potentially suggest for the physician to come do a further assessment and see this patient. And for comfort measures, I will administer an antipyretic, specifically Tylenol, to help with his fever, an antiemetic to help with his nausea, and also potentially an ice cold pack to maybe help with the pain if that does not alleviate it. Now, what I think is going on with this patient is it could be an underlying infection. He does have some stiffness in his neck, so this could indicate meningitis just because he is febrile, but also we could be experiencing an upper respiratory tract infection. He comes from a low-income family, from a low-income neighborhood, could have an acuity acquired, potentially pneumonia. So some intervention I would advise is a strict in and out and fluid management, making sure that the patient, as he is diabetic, making sure that he is not experiencing any dehydration, especially since he is nauseous. We need to ensure that the patient is eating appropriately and drinking enough fluids. And second, I would monitor this patient heavily, ensuring to do hourly rounds, just to ensure that he is not experiencing sepsis, hypotension, or that his febrileness is not worsening, or that his temperature is not worsening. 2 orders I expect from the physician are first a workup of his CBCs or his blood count, and potentially experiencing to see where the infection comes from, potentially a COVID-19 swab or a respiratory panel to administer or find out further where an infection could be happening from if one is occurring. And the second is a chest x-ray and an ECG. The chest x-ray is just indicative of looking further into where his cough could be occurring, and why he has some chest tightness is why we would order an ECG. And that is all. Thank you.